There's a great history of innovation in the NHS. That's the first message. The second is that we're facing increasing demand in a tightened fiscal environment, and the thing that is going to solve that very difficult, imbalanced equation is our ability to innovate. And my third message is that the best people for guiding that innovation, even if they don't do it themselves, are clinicians who share the anxieties, fears and aspirations of their patients.
Well, I really want to use today to gain some new insights into the types of innovative projects that are going on across the area. In a very recently newly adopted role that I have with the STP around being a clinical champion in primary care in the digital work stream, I think it's really important that I get to grasp exactly what's there and what the challenges and the opportunities are going forwards.
So the one that we are using it for is to deliver pulmonary rehabilitation, and pulmonary rehabilitation is a program for people who are living with chronic lung conditions. It helps them maintain their independence, helps them maintain their lung capacity so they can breathe better, and reduces their chance of developing flare-ups or needing hospital admissions. Or if they are admitted to the hospital, the length of stay in the hospital is substantially reduced.
So we created a digital platform to connect patients with their GP, and we provide a number of unique services to primary care. I mean, one of my key phrases are work smarter and not harder, and that's essentially what GPs spend a lot of time, stuck in clinics. The home visits take up a lot of resources, but in this way, a GP does not actually physically have to go out. He can empower a nurse, a paramedic working at his practice, or a pharmacist that can go out and assess these patients, and he can assess all that information in the comfort of his office in the surgery without having to leave. And that to me is one of the things that I think is needed in primary care, so GPs can spend more time focused on caring for patients.
Today is meant to be about innovation and STPs. So I'm going to try and paint a fairly relaxed picture for you about what I think the role of STPs are and how they relate to innovation. But you might be forgiven for thinking that the NHS is in a pretty precarious position when you pick up almost any newspaper or turn on the radio or watch the box. I don't actually share that view. I share that it's at a turning point and a point of great opportunity.
It was a very good event to learn and share the knowledge and experience with my other colleagues. Basically, I'm a consultant psychiatrist, and today I've learned and passed the message and also received the message that the community care, how important it is for the patient to sustain the progress and to share the care. There's nothing like shared care in the community, and I think it works better.
I think the key messages for me today are about the fact that we all need to collaborate, and we really need to work together to change things. We really need to engage and activate our public, our citizens, our patients in any transformation that we undertake. Technology is a fantastic enabler, but it is an enabler and it's not the cause or the solution to the problems we've got. It's really about people and engaging the hearts and minds of people.
What I take away from today is there's been a huge amount of energy in the room, very much around how we can all work together. There's that openness, that feeling of wanting to work together and doing that within our own communities. So coming from a community pharmacy background, that was really important to help that we look at that local level where people live, where they work. It's really encouraging to hear that being talked across all the disciplines today.
A key message that people might want to take away from today is that clinical responsibility doesn't begin and end in a consultation. It extends to clinicians helping to shape the future of healthcare and services for their patients, not just now, but for the future.